Hey everybody, welcome to the Healing Place Energy School. My name is Helen Chen Liu. I am a certified reflexologist, certified energy medicine practitioner, Reiki master teacher, the author of Know Your Chakras, Introduction to Energy Medicine, and Foot Reflexology to promote relaxation. Today, I want to share a reflexology tip on how to help yourself or loved ones whose kidneys are failing. In this case, the person in the video has diabetes and has unfortunately lost a lot of blood circulation to her kidneys, where her kidneys are slowly dying. This tip that I'm about to show you will support whatever kidney functions that she has left. But again, it's just a quick tip. If you want to learn some advanced reflexology for kidney support, stay to the end and I want to show you where you could take this incredible class. Let's go to the Healing Place in Medfield, Massachusetts, and I'll show you what to do with yourself or your loved ones. So this is the client's feet. I don't know if you could look at it a little bit closely, but the color is a little bit orangey and gray. Because I've done so many of these healing sessions, when I see a different tone color like this, to me, this is an indication of it could be something going on with her liver, the kidney, or perhaps it could be her natural color. But because it has like an orangey gray tone, that indicates to me there's something going on in her filtering organs that's just not filtering well. So I'm going to show you what I would do to support the kidneys, and then this is going to be a quick tip. And then for if you're interested in learning how to do advanced foot reflexology course, I have something at the HealingPlaceEnergySchool.com that will do I would say 30-step protocol. So the kidneys are located right about here. This is the stomach area. All right, client, I'm going to right on your feet. Here, this is the stomach, and right about here, this is your adrenal, most people's adrenals, and right underneath is the kidneys. So this is where I am going to focus in this area. So the client right now, she was diagnosed with having stage 4 kidney fail, which is obviously not good. And what I'm going to work on is trying to support whatever little kidney functions she still has left. When I did this session on her last time, I noticed there was more of a deficit or painful spot on the left side of the kidney. So here, the left side is pretty much the same place. I'm going to show you this tip only on one foot because you could replicate it on your own. And your left kidney is the bigger kidney out of two, and it's a little bit higher than the right kidney. So these are the two places I'm going to emphasize here by pressing. And what am I feeling for? In the case of when a kidney is not doing well, sometimes it just feels spongy, like as though there's nothing happening. Usually, like right about here, I could feel like there's a tiny stone. So some people will get that confused. It could be the adrenal or the kidney. So what I'll do is I will cover the whole box. This box in the mid-level of your foot is really vitally important. You have your stomach, you have your adrenal, your kidneys. On this side on the right foot is your liver and your gallbladder. On the left side of the foot, you have pretty much the same organs, your stomach, your adrenal, and your kidneys. Instead of the liver, it is the spleen. So I am going to come back and just press in this area. And what I'm feeling for is I want to see how much function she still has in her kidneys. And I can feel there's a tiny bit in the right. And how can you determine that? This is a hard one, because unless your hands have given a lot of reflexology sessions, see here, and I'm feeling too, I forgot to mention your pancreas is also on the edge here. And this client is also a diabetic 2 person. So unfortunately, diabetes can cause kidney to not function. And what happens is because the pancreas take away blood away from the kidneys, so the kidneys become starved of blood, which carries oxygen. The oxygen is what does the healing. So as I'm pressing, again, I'm just noticing her left kidney is slightly more tender. Can you feel this, client?
I can.
Okay, so she could feel this. So how often to do this? You could do this protocol every single day. 30 seconds per foot. You don't want to overstimulate, because overstimulation is just as bad as not doing anything. That's just a quick tip, but if you want to learn more advanced foot reflexology, check out my school site. The link is below.